Mars, and I'm here today to talk to you about the Bargaining Unit's initiative to unionize the majority of the workers here at Allegheny General Hospital. What I want to discuss first and foremost, I am a manager, but I'm married to a union worker. Our family has reaped many benefits from the strong union that my husband is involved with. So I understand the bargaining unit 100%. I also understand it from a management side and how it limits the hospital's ability and management's ability to manage their labor. That's a little bit about why I'm here today and what I want to discuss with you. So what I'd like to discuss is the pros and cons of bargaining unit. Today, PA has a couple labor laws. In 1937, PA passed labor relation laws, which basically meant that the employer and the employee had the right to open conversation and also had the right to employ a bargaining unit if desired. In 1970, PA also passed a Public Employee Relations Act, which actually meant that the bargaining unit and the employees and the management and the employer had to work very well together. With this act, it helped along the lines of grievances and having arbitration. So PA today is currently a very positive bargaining unit state to work in. It also has very strong labor relation laws, which means that it monitors age of employees. Anybody under the age of 16 must have a note from their parents and must have limited hours. It also monitors the minimal amount of pay that people can have. Also, in the most recent years, PA has instituted the fact that you have a limited amount of hours that you can work. So it is very it is very employee friendly in Pennsylvania. But again, it supports bargaining unit and the right for an individual to vote for a bargaining unit. So what benefits do you get from a bargaining unit? That's very important. If you are involved in a bargaining unit and Clay, your bargaining unit agrees that they will absolutely get you $10 more an hour, is that a legal contract? No, it's not. Nothing that a bargaining unit presents to its employees is legal and binding. They can offer you the world, and they can give you nothing. That's one of the downfalls of bargaining units. Legally, they're not bound to anything that they say for the employee. That's definitely a con, especially whenever you're discussing with bargaining units during negotiations and during the time that they want you to vote. They are going to offer you the world, but they're not legally bound to give you anything. Another one of the restrictions a bargaining unit has is you have to be represented. So if you get fired from the hospital for whatever reason, you are no longer an independent employee. You cannot go and argue your case independently. You must have representation. You now belong to the bargaining unit. It depends on whether or not you want to belong to the bargaining unit. In turn, you have to pay dues. So right now, as I stated, SEIU is currently in negotiation with the employees here at Allegheny General Hospital. SEIU is a service union employee supported organization. The interesting thing about SEIU is they, in the 1990s, were very service union. They mostly did janitors and cafeteria workers, some of those type of jobs. In the 1990s, their dues dropped off dramatically. Because their dues dropped off dramatically, they found a whole different avenue and started to pursue the nursing career. Nurses at that time were frustrated by very financially starved organizations, not getting raises, working a lot of long hours, and not having restrictions on mandatory overtime. So when the SEIU decided to get into the healthcare profession, they offered no mandatory overtime and increase in salary. They have yet to present strong evidence that they have instituted either one of those that are on their platform to support the employee. Currently today, our nurses in Allegheny General Hospital belong to the union. They pay $80 out of each paycheck, $160 a month, based on their salary. At this point in time, my individual nurses will, some say yes, they've been very supportive, others have said no. That's for you independently to decide if you want to be in a bargaining unit or not. Each employee has the right to vote. The important thing about a vote for the bargaining unit is the fact that if you have 300 employees and only 10 show up to vote, if 6 vote yes, those 300 employees are now unionized. So one of the most important messages that I could sing here today is the fact that you as an individual have the right to vote, and you must institute that right to vote. In conclusion, I wanted to demonstrate today a little bit about the bargaining unit, why SEIU has become a very integral part within the healthcare organization and nurses, and to give you some pros and cons from the hospital side about bargaining unit. Thank you for your time.